How are you, doctor?
I'm fine, trying to cope with the coronavirus, trying to cope with the effects that it's having on the whole country and patients generally. Their misinformation, getting the correct information, filtering out everything that's out there. And of course, being a medical professional, having to go to work and interact with patients who may or may not have the coronavirus.
Well, most prominent on everyone's mind and lips is the coronavirus pandemic. And today's topic seeks to clarify concerns regarding this virus and pregnant women. So I definitely have some questions for you.
Okay, great.
What effect does coronavirus have on pregnant women?
Just like the coronavirus will affect an ordinary person, it affects a pregnant woman the same way. Pregnant women do not appear to be more likely to be unwell than a healthy adult, and therefore, she is no more at risk to develop a new coronavirus. It is expected that the majority of pregnant women, anyway, will only have mild to moderate flu like symptoms because they are generally well patients.
What effect will coronavirus have on the baby?
As this is a new virus, there's not much evidence so far, but however, initial reports show that there's no increased risk of a miscarriage in the first trimester. Also, current data is showing that the virus does not appear to cross the placenta and therefore doesn't appear to be transmitted from the mother to the baby before or during labor. Strong evidence is suggesting that if a baby gets the virus, this might have been picked up after the baby was born. Also, there's no evidence to show that the baby will develop any congenital abnormalities if the woman is affected at any point antenatally. This means before labor. Also, there doesn't appear to be any evidence that the virus induces or causes early labor. From most of the studies out of China, women who were delivered early, this was done because of special reasons. Either it was an obstetric indication, or maybe she had the coronavirus and her respiratory system was compromised and they had to deliver the baby to save the mother's life.
What can a pregnant woman do to decrease the risk of catching the coronavirus?
It's the same recommendation as for everyone else, which is basically frequent hand washing with soap, using hand sanitizer if that's not available. Use a tissue if anyone coughs or sneezes and discard immediately. Avoid contact with anyone you may know who have symptoms of a flu. Try not to go out in the public, such as using public transport. Try to work from home. Avoid a large home gatherings as well, such as having your relatives over, also going to restaurants, leisure centers. You know what? Some of us would want to have large barbecues at home, but still try to avoid that because you don't know if someone you're inviting has that virus and can actually pass it on to you. There's also one other thing that I wanted to mention, and there's a lot of debate on it, is wearing a face mask. Different countries are recommending different things, but if you actually look at the evidence out there from different countries, and this is mainly from the eastern side where the virus actually started, countries that recommended wearing a face mask for everyone as when you leave your home, those countries have been shown to have a low incidence of spread. And that evidence was coming out of the Czech Republic, also Singapore, and also Korea. And basically, it was recommended that everyone use a face mask when they leave their homes. It's not only about protecting other people, but it's protecting you as well.
With regards to coming out, should women attend antenatal clinics like normal?
Yes, we still recommend that women attend for antenatal review because this is separate to the coronavirus. Years of studies have shown that antenatal visits are very important and it has shown to reduce the risk exposed to a mother and a baby. Therefore, you should contact your local health center or your obstetrician to determine whether you follow a normal routine or whether it might be slightly delayed once you and your baby are well.
What should a woman do if she is suspected to have the coronavirus?
Right, so there are many different symptoms, but you have a high suspicion if you have an elevated temperature and a new or continuous cough. If this happens, it is recommended that you call the hotline for further screening to see whether you meet the criteria for testing. And they would recommend whether you come in to be tested or they would come out to you to be tested. If you are positive, you will then have to isolate yourself. Currently in Trinidad, we are not recommending isolation at home because you can pass this on to your relatives. All patients, whether pregnant or not, are being asked to come to the isolation centers at CUVA or CORA until you recover. If you are pregnant, you will be managed by an obstetrician at one of these centers.
If a woman is at the center, what would happen if she goes into labor?
Currently, San Fernando Hospital, Port of Spain Hospital, and Mount Hope Hospital have been set up with isolation units. So if you go into labor, you will be transferred to one of these hospitals for delivery.
In terms of delivery, does the pregnant woman with confirmed COVID-19, this coronavirus, have to have a cesarean section?
No, not at all. A cesarean section is still only recommended for obstetric indications, such as if a baby is not head down, if there's a placenta previa, which means there's a low-lying placenta, if someone is in labor and the baby's heart rate is dropping, those are recommendations for cesarean section. However, a non-obstetric indication would be if she currently has the virus and she has severe respiratory distress, then it may be recommended to do the cesarean because that's a quicker way of delivery. And they'll be doing that to save her life.
Will the baby get the virus if the mother has it?
Again, there's limited data because this is such a new virus, but a few babies have developed the COVID-19 after birth. Most of the evidence is suggesting that the babies may have picked the virus up after they were born rather than while they were in utero. However, there is only one case in Wuhan where it's questionable, and that case, the only one picked up so far where they do think it was vertical transmission, or basically the mother did pass it on to the baby, but everyone else, there was no evidence that it was passed on from mother to baby during labor. They think it's after labor.
After delivery, can the mother breastfeed?
Yes, of course. Again, there's no evidence to show that the virus is present in breast milk. The main risk for a baby getting the virus after delivery is actually if the mother coughs or sneezes on the baby while she's breastfeeding.
This has been very informative, Dr. Bisondat. Is there anything you would like to reiterate as we close here?
Just remember, pregnant women are no more at risk, but you follow the same procedures as the general public, which is good hygiene and social distancing, wearing a mask. And one thing that I have noticed with patients coming into the nursing homes and even in the public, they are not wearing masks. I don't know at this point in time if the recommendation will change by the government, but it's a safety precaution. If you're going into a space with lots of people, protect yourself and protect others. If you can get a mask, I would recommend wearing one. I know there's a shortage, but I'm sure some will be coming in soon.
How can someone get in contact with your office?
So I work at Southern Medical, and you can call me. By direct numbers are 290-1249, and my assistant Natalie, it's 394-7528.
Thank you again, Doctor. This is a challenging time for everyone, but we must all do what we can to help each other through this. Keep healthy and stay safe.
Same to you. Bye.